This is Orsi, official old guy at oldguytalkstome.com, a podcast dedicated to helping older guys create kick-ass lives for themselves and those that they love. It's for women too. Each week, I bring you a special guest to help you create that life that you imagine for yourself and those that you love. We talk anti-aging medicine, personal growth, relationships, and sex, vices, and other topics that many don't want to talk about but need to. Just because you're getting older doesn't mean you have to be old. Also, if you want to know 3 ways to get laid more frequently without begging, go to oldguytalks.com and opt in. When you do, you're going to get my informative video on 3 simple things you can do to get laid more frequently without begging, so you don't have to turn in your man card. And ladies, you may want your man to know these things, because I think you'll like it too. Additionally, you'll be notified weekly when a new podcast episode is ready for you to consume. Periodically, I will share with you other stuff that will help you create that life that you want for yourself and those that are important to you. Don't want to miss anything? Be sure to subscribe, share, and review this podcast. This is Orsi, official old guy at oldguytalkstome.com, a podcast dedicated to helping older guys create kick-ass lives for themselves and those that they love. And part of that, well, is dealing with the healthcare system, which can in and of itself be, well, very confusing. And it can be confusing for you. And if you happen to take care of parents or other people, then it can be confusing even more so because you end up getting different answers to the same question from different people, and sometimes you end up going in a circle, and a week later you're back to the place where you originally started, and they said, but they told me you're the person who can make the decision. And so we've all been there. Today I have Lisa Cassaro, who is a Wellness Solutions Strategist and legacy advisor and long-term professional patient advocate with more than a decade of healthcare experience. She's also an entrepreneur, and for more than 25 years has been a community group leader, including as a co-founder of an amputee and caregiver support group. She also in November obtained her national credentials as a board certified advocate. She's worn all sorts of hats as a patient, as a caregiver, as someone well acquainted with grief, saying that she can empathize and have compassion for clients she serves. Although her parents are deceased now, she's also been a sandwich generation, we're going to talk about that more, woman, and that doesn't mean making sandwiches or eating them, that's a whole different term, co-caring for her parents long distance for several years in so many ways. And she also specializes in advanced care planning for individuals or groups, reviewing medical care plans, and locating second opinions, resolving insurance discrepancies, or navigating a healthcare journey. That's quite the interesting stuff. So, as the CEO of Cope and Hope Advocates, she works mainly to help sandwich generation women and men reduce stress and gain peace of mind over their healthcare decisions and finances. And so, Lisa, welcome to the program. Welcome to the program.
Well, thank you so much for having me today. I'm really excited to be here.
I think we have a topic that's very much on the minds of people, and they may be living with things on a daily basis. But I'm going to ask you my question. First question is, what is the most important thing you did today?
The most important thing I did today was I grounded myself first thing this morning. Now, it was a little damp outside. Normally I go outside and kind of stand on the earth, or I live in the mountains in Northwest Arkansas now. So I'm enjoying that. I'm originally from California. So this is a whole new culture and a whole new area for me. But I usually go outside and do some prayer and meditation and just get in contact with the earth. And there's something to be said for that. I think, they say that the electrical charges between your feet and the ground, I'm no expert on that area for sure, but they say that those electrical charges have a lot to do with getting you better effects for sleep and reduce pain. You can, you can walk around barefooted, you can sit, you can work, but all of that helps to create a better source of energy for me. So that's the most important thing I did today.
Yeah, yeah. That morning ritual, I think, is very important, especially if you
Yeah.
don't have one. You should have one. And I did a little bit of grounding. I never really got into it, but I do a lot of meditation, journaling, and other things before I start my day in the morning, including
Yes.
exercising. So, Lisa, how did you get into the space of as a patient advocate?
Oh my goodness. Well, I mean, it started really about more than 30 years ago when my then 6-month old first son was diagnosed as being terminally ill. And I became a vocational patient advocate. That was my first foray into the whole mess. And that was before the internet happened. And so I was down in the medical research libraries out there in Orange County and looking up everything that all of the specialists had for him and trying to figure out what we could do for this kid. I mean, this was my baby. So that's how I kind of got into it. And then after that, many years after that, actually, I was married to my third husband, and he was diagnosed at 47 years old with a rare form of kidney cancer. This is back in
Mhm.
like 2005. And I again engaged in his advocacy. And that was a several 100-mile journey going down to LA, getting care. He did lose his 18-month battle, and I was a widow at 47. So I went back to school because I loved it so much, actually, being able to be there for him and also for other family members at the time. And I became I took a course, a 10, it was a non-credited course, but still very thorough at Cleveland State University. Took a certificate program. And then I started working as a paid social work coordinator in a rehab hospital, also known as skilled nursing facility. I've also done assistant case management in long-term acute care hospitals, which are like step-down hospitals for ICU. I've worked as a cancer genetic assistant, serving over 1,000 clients that first year. I founded an amputee and caregiver support group, chronic illness and caregiver peer group, and I also served almost 840 hours as a hospital chaplain.
Yeah.
And so,
So, yeah,
yeah,
yeah.
it's
I'm sorry. Go ahead.
no, that's okay. I was going to say, so I've been all over the place as a paid and non-paid patient advocate and decided to go into business for myself.
Yeah.
So,
So, when should people consider getting an advocate? Should they get one right away, or when problems occur or challenges occur, or how do you see? When's the best time for people to come and see you or reach out to
well,
you?
I would say that, for most people, you can generally handle the run of the mill, go to your doctor once a year and perhaps get, your wellness checks and things like that. But usually what happens, honestly, is that people wait until there's a crisis, either with themselves or with someone that they're caring for.
Mm-hmm.
And then they reach out because they're overwhelmed with the choices they have to make. Maybe it's a serious diagnosis, maybe it's a chronic condition that has then taken a turn for the worse. A lot of times people will call me when they live on one side of the country and mom or dad lives maybe closer to where I am. That's usually how they come to me. But I do service clients all over the US. So, that people should come to an advocate as soon as it's something in the medical business that is out of their league. And figuring that out sometimes is a hard decision. We all want to think that we can navigate medicine, but it's become very complicated, even for advocates, especially since COVID-19.
Yeah, I can imagine that there's a lot of challenges because even for myself, I had to get a therapeutic phlebotomy, and there was all sorts of crazy stuff involved with it. And I'm kind of like a dog on a bone. I get onto something. And I finally got to the person who was making the decisions, and she walked me through, and I had to actually go back to her 2 or 3 times, because people that I was encountering in her company were not giving me the same answer that she was, and she had to basically get involved. And she actually became my patient advocate to a certain extent. And we find, it was good. I actually met her in person when I was getting my therapeutic phlebotomy. But it was an interesting process, because it was so convoluted, and you could do this, but you can't do that, and if you did that, then this became void, and this and that. It was a part of the challenge was also us dealing in 2 different states.
Yes.
And so that was a challenge. So, Lisa, give us some examples of some things that you do in terms of patient, some of the examples of some of the patients that you advocate for, and what kind of things have you run into, and what kind of things did you have to do to overcome those challenges?
Well, certainly in different healthcare settings, you advocate in a different way. As a private patient advocate, there's a whole different set of circumstances. My general population of clients tends to be these sandwich generation people, and I would say that if your listeners aren't familiar with that term, it was a term that was coined back in the early 1980s by a couple of social workers, and it describes people who are caregivers, sort of sandwiched between 2 generations, if you will. It's really adults and loosely defined as adults who have a living parent age 65 or older. And then they also are either raising a child under the age of 18, or perhaps supporting a grown child. And that could be anything. That could be a college age student. That could be, someone who has already maybe graduated from college, or they're married, and for whatever reason, they end up moving back into mom or dad's house, or there's a number of reasons why we might support our grown children at different times. And so many of those people provide care, direct care, or financial support to their parents and their kids, like about 38%. And so that's a pretty high margin. And a lot of the people that I deal with are those people that call me and ask for my help. So one of the things that I have done is, and this was pre-COVID-19, because like everything is, BC, like before COVID, and now we're kind of going into the after COVID in many states. But many of those situations that arose, and I got quite a few calls during this last year where people were extremely distressed because perhaps they had a parent that was in a skilled nursing facility, or a convalescent home, as it's also known. And a lot of times those people wouldn't know what to do, of course, during the major part of the crisis, especially early on. People were not allowed to even visit their loved ones and in fact, I had a friend who called me from California, and her dad was he had pre-existing medical conditions, and he was in his late 70s. And he was bouncing between the hospital and rehab or skilled nursing. And she was beside herself because her mom couldn't go visit, and she wasn't able to go visit. And so I was able to use actually a couple of connections that I had and talk to them and try to work out a couple of alternatives. Sadly, many people experience the fact that their loved ones ended up passing before they were able to be present, especially early on. Now, some of that's changed, and they're back to at least, but they are restricting visitors still in hospital situations. So, my recommendation for people is always to just call ahead and make sure whatever facility your loved one is in, find out what the ever-changing visitation policy is so that you can find a champion. Like
and hopefully you get the correct answer.
That's right. That's
Hopefully
right.
you get the correct, because I'll tell you, Lisa, I always ask.
Yes.
And I write it down because I'm just that's my OCD.
Yeah.
I write down. I said I spoke with Jane at 10:45 from so and so in this department, and this is what she said to me.
That's right.
And so if that's not accurate, you need to go. Let's go track Jane down.
That's right. And you know what? You do have to do that. And your first line person, the first no you get may not, if you got to know, that first answer may not be the one that you want. So you do you have to know who to ask for.
Wow.
And that's one of the things that an advocate can help with, because the healthcare system is kind of set up like the military, if you will, a very distinct order of, who does what chain of command.
Mm-hmm.
And so you have obviously the person that might answer the phone is going to give you definitely a different answer. They're just going to be their toe in that party line there from the corporation, if you will, or the business. And, you may need to go up to, in this case, in the case of a nursing home, the facility administrator, which is generally the highest person there. You might talk to a lower level, a director of nurses or something like that. But you have to know who to ask for, because they are not going to tell you necessarily who to talk to. So, but you're right. I mean, being that dog with a bone, you have to be that, especially in healthcare. You'd make a great advococate.
Oh yeah, I'm too old for that. It's a thing, because a lot of times, like, when I hear that's our policy, and I go, well, there's always variations of policy. Who makes a decision on those variations? Let me talk to them. I said, there's no upside. There's no upside in belittling that person who's just doing their work and trying to keep a job.
Okay.
We are recording now.
Okay.
Go ahead.
So what I think the important thing to know is whether or not your loved one is in a regular hospital or an acute care setting, or whether they're in, a skilled nursing home, or even if they're just living in an assisted living center, or other type of medical environment, or even non-medical environment. Being a sandwich generation caregiver is unique into itself. Sandwich generation people, because they're taking care of, perhaps mom and dad and their kids, they face a number of obstacles. Some of those things are like, they're stressed out. There's issues related to money. There's lack of time. There's the health of the loved one and their own health that can get in the way. Those are leading sources of stress. And actually, if you're looking at numbers, probably most of the public now, from the data that I've looked at, nearly 75% say that caring for an elderly parent is their responsibility. And by contrast, you've got only about half of people who are parents, who identify as being parents of a child of any age, say that it's their responsibility to provide financial assistance for a grown child if he or she needs it. But, the interesting thing is that I think about 60% of the sandwich generation caregiver people are women, although the number of men is rising. Do you have any experience with caring for older adults yourself, maybe parents or in-laws?
Oh, yeah. I mean, we had that. My mother passed away about 8 years ago. And so there was we had to deal with that, and she was living close to us. And then we still have, my mother-in-law is still alive, and so we're still providing support for them in those ways. And there's all sorts of dynamics, and actually that kind of leads me into the next question. So you got families involved.
Yes, in-laws and
And
outlaws, as I like to say.
yeah. And a friend of mine once described family time as the opportunity to spend time with people you normally wouldn't associate with.
That's right. We don't get to pick our families, do we?
No, we don't. No, we don't.
We don't.
But well, this is not for this, but we can pick who we associate with.
Yeah,
and
that's true.
Sometimes you do have to cut family out because they're toxic.
Toxic. That's right. I would agree with that for sure.
Yeah. So how do you manage, because dealing with family members, and let's say, okay, so you got your client who's the primary person, who's the one who's receiving the treatment, and and then you got the family members, and you may have a primary family member who's in charge, but then you got all these peripheral people that are giving you advice because they don't, but their advice is theory because they're not dealing with it on the ground.
Right.
This is a situation we ran into. And so how do you decide to prioritize that in terms of, because there are times you have to make a decision about which direction you're going to go.
Yes.
And so how do you manage that decision?
Well, if we're talking about end of life decisions, is that what I'm hearing you say? Maybe.
No, I'm not talking about maybe just regular general stuff, because end of life decisions are, at least from my experience, they're fairly obvious.
Yeah.
Okay.
Yeah.
So there wasn't like a lot of, it wasn't like, we're gonna keep mom or dad on a ventilator for 10 years.
Right.
Because that's not good for anyone. But there are things along the way before you get to that stage where you may have a divergence of opinion about what to do. So talk to me a little bit about that.
Well, and so I understand that, and that does happen a lot. So the first thing is to talk to the person who's needing the care, mm-hmm. and find out what they, as long as they're able, as long as they have cognitive awareness and they haven't suffered a lot of cognitive loss, their input should be really important to the situation and to the conversation. Being a caregiver itself, and I say caregiver loosely because that doesn't necessarily mean you're providing hands-on care. You could be providing, again, that financial support or emotional support to someone. But, you have to be able to have those conversations with this, maybe siblings is usually who that kind of falls, either the person, like, let's say it's your mom, maybe your mom's sister or brothers might still want to get involved and try to help with those decisions. But usually it's siblings of, of like your siblings that would have wanted to have a say so in what mom or dad wanted. That's been my experience as well. And for the most part, when I was in, especially in the skilled nursing level, where we had patients come in for rehab, and let's just say that, and this is many of them, many patients come in for rehab, they're not able to get back to their baseline. They can't necessarily go back home, at least right away. So then it becomes a situation where you've got to place someone in 24-hour care. And, I would oftentimes have patients, family members who hadn't seen mom or dad for 10 or 15 years. And all of a sudden they fly in from Iowa or something, and they want to give all of their opinion and try to, sway mom or dad into making decisions to include them, when in fact it's been maybe another of their children who's been in the area or helping them all along. But I'll tell you, one of the things that is a problem is that there's a lot of elder orphans out there now. That's what we call them in the business. And those are people who don't have any children to help them care for them, help them make care decisions. So that's another story. But what you can do, you can focus on, we used to bring families together in family meetings. So you have to be able to have those family conversations and find out what people are able to do and what they're willing to do. And sometimes those are not the same two things. Sometimes people are able to do a lot of things, like they are able to physically provide help because maybe they're the youngest sibling, but they are, let's say they live in another state, or let's say they have plenty of money, but they're not willing to pay for mom or dad to go into like an assisted living center. So then everybody's scrambling, trying to figure out what to do. You have to decide who is going to help manage finances, schedule appointments, help your parents decide what they want to do first. And, the problem is that a lot of times, I think we can circumvent this problem as a woman who's aging, and I have adult children now. I have actually made it a point to have conversations with my kids and to put things in writing, things like advanced medical directives, medical powers of attorney, a trust, so that everything is clearly spelled out how that needs to go after I pass away. A lot of times families don't have all those things in place.
Yeah. You know what? I will say this because we've done this with our two kids, and I caution all listeners that if you have kids that are adults now, you no longer have authority over their care, and you better have a medical directive, legal papers that allow you to, if with their knowledge and their permission, their acknowledgement, to be able to step in if you need to, because it can be a nightmare if you don't. It can be an absolute nightmare. And I'm not saying, God forbid that's the direction it goes, but it does happen. Your child gets in an auto accident, whatever may happen, and all of a sudden you cannot be out there looking out for the best interest of your child. All sorts of other people come into play, decision makers that you normally would not want to have in your life.
Did you know that there are 76 additives that have been approved by the FDA that can be added to wines? You want a wine with shit in it that may not be good for you? Well, there is an option for wines that have been produced naturally, organically, that have been tested, that have no sugar. And when they don't have any sugar, that means that they're ketosis and intermittent fasting friendly. These wines have been produced with a great deal of care on small farms and are available to you. How do you get them? Find out by going to www.oldguytalks.com/dry farms, all one word with an S, and find out more. And with your initial order, you can get a bottle for 1 penny. That's right, a bottle for 1 penny. And they taste great. They taste great. Don't wait, don't hesitate, don't procrastinate. Get those wines now.
You're absolutely correct, and actually, you're tugging at my heartstrings there, because I spend a lot of time educating people on getting an advanced medical directive in place, and doing a one-on-one private session to talk about values and to talk about the actual execution of a document, and how those documents need to be filled out, as well as electronic versions that are available in some of the programs I have and out there. So I have a lot of information about that. I've been teaching that for a long time. If I can just kind of go down that pathway for just a moment, if you don't mind.
Absolutely. Please do. I think it's very valuable.
Yeah, none of this is easy stuff to talk about. None of us wants to talk about what could happen if, and it's really for a lot of people, it's not if something's going to happen, it's when something's going to happen. Not everybody, ages gracefully and lays down and has their last breath with family and friends around them, although that is considered actually with some of my death doula friends, and there is such a thing called a death doula out there now. People who help people plan the end of life experience as best as they can. But as far as advanced medical directives go, did you know that the 3 landmark cases in the United States that led to even having advanced medical directives occurred because the women, all 3 women were under 30 years old. That was Karen Ann Quinlan, Nancy Cruzan, and Terry Ann Shivo. And all 3 of those were national cases in their time. And all of those led to different areas of either having an advanced medical directive available and having, being able to execute one, obviously before something catastrophic happens, or end of life care, and who can be a decision maker. But it's true with HIPAA laws now. And as a chaplain, I have been in the hospital, in the emergency room, and there's actually been arguments among family members with, what mom or dad or what the child would have wanted. It's really sad when you see, the kids, the ones that have maybe been in a car accident, and then their parents come in and the doctors are saying, what to do. And I mean, adult children over 18 years old, what to do. And they only give them limited information. Now, there is a legal order in which they have to call people for decisions. So there is some leeway, but there's a lot of information that cannot be provided to someone if you don't have the proper legal
Absolutely.
Release. And it can be a nightmare, and people are not aware of that. And I'm glad you are open in this forum to talk about that, because it's real and it's unfortunate, but there are things you can do to mitigate that, and that's to get the documents done up front.
Yeah, and I mean, we're in the middle of actually updating them, because they're changing, and our kids no longer need a guardian in case we pass away, and also some of that stuff. So
Right.
a lot of stuff changes. So it's not like a you're done and you put it away and it's forever gone. You kind of need to review it, because the laws change also, and they also need to be consistent with the laws, and so that's
true.
That's a whole another nightmare. So
I just want to say one other thing about that. I like to tell people at least do it once a decade. I've seen medical directives that were executed 20 years ago. So the people that you might have chosen might not even be alive anymore, or cognitive enough to make those decisions for you.
Yeah. Or you may have argued with them and you don't want them making decisions with you. And once a decade, I think and we're not offering legal advice here. Just as a disclaimer, consult with the appropriate professional to do that. Right. But as far as how often that you should do that, but you really should. I would actually reference a podcast I'd done a few months ago. I can't remember his name.
Once a year on your birthday.
But it was about end of life discussions. And so it was very interesting. We talked a little bit about the advanced medical directives and things like that. So Lisa, okay, so you have someone who's sick and they're dying.
Yeah.
Tell us about, when do you bring in hospice as one alternative at that time, and what are the decisions that come into play when you bring in hospice? Because when you bring in hospice, you really you've gone from trying to rescue to actually make the transition comfortable. So when tell us a little bit about that, and when do you make that decision, and how do you consult with your clients?
Well, some of the other things, there's quite a few things in between somebody being sick. Now, you did mention the scenario of someone dying, so there's still some limitations there. But it really depends on if the person is where in proximity that person is to care for themselves, because hospice in many states, of course, that is a doctor's order and is only accessible through a doctor's order. They need to determine that that life expectancy is about 6 months or so. Now, a person can go on to hospice care, and they can actually go off of hospice care. They actually reevaluate the clients that are on the care services for every once in a while. I think it's every 90 days, but sometimes more often if their medical situation is changing. But there's a lot of options before you get to hospice, like caring for people. You've got home care agencies, which can provide like companionship, help with activities of daily living. It's someone that you hire. It's an out-of-pocket expense. It's not covered by insurance, but they can do meal prep and housekeeping. They can provide transportation, but it can also be kind of expensive. So that's where someone needs to have a conversation with perhaps mom or dad and find out where the finances are. Hopefully this has all been done ahead of time so that you have a general idea of what can be, what's affordable. You could do that even part-time and fill in on your own. Let's say that you're a working person, and again, generally it's women, and you can care for mom, a couple of days a week in in her home, because her desire is to be at home, and then another couple days a week for a few hours a day she brings somebody in from a home care agency. Now that's different than what people think. Oh, I have home health care. That's different. Home health care is nursing care or therapy that is provided by licensed professionals, generally when a person can cover those things in an outpatient basis in their home. And there's medical criteria for that. And Medicare and private insurance can cover that. So sometimes between home care and home health care and a family member, you can cover someone at least for a period of time, assuming that they might get better. Okay. Yeah. If they are still able-bodied, there are still things called adult daycare. And you can, that's a lot of times an out-of-pocket expense, but veterans can take advantage of that as well in some situations, and family members get a respite away from caring for that person for that day. They cover everything from meals to activities and things like that, but it's in an outpatient setting. So they're going from home and going to the facility. Hospice care is, again, end of life care. And in some states, like in my state, there's actually hospice houses out in California. I didn't see them very often. Most hospice care is provided in someone's home or in the home of a relative who is going to and has agreed to care for the person until end of life.
Yeah, that was what we had experienced basically with my mom.
Yes.
So let's talk about, as we're talking about end of life here, how do you help people with the DNR, do not resuscitate orders? What's your preparation in terms of as a patient advocate for someone, and where does that come into play from your perspective?
Well, a do not resuscitate order, or DNR, is actually also a doctor's order. So it is a legal order, like what they would write for a prescription. This is a prescription to not resuscitate the person or provide CPR for end of life. And generally speaking, that is reserved for either in a hospital situation, or in some states, they're called POST forms, physician order for life-sustaining treatment POST forms. Some states call them MOST forms, medical order for life-sustaining treatment. And a person at home could have one of those. They're generally, I was involved in California many years ago with a group called the Compassionate Connection, I think was the name of it. And they were trying to get the idea for POST forms passed, that they would actually, what it does is it gives a patient a pink, bright pink, hot pink order. And again, that is a medical order. And it gives the patient that document that they can put it on their refrigerator at home if they're in a situation. Usually advanced age people or someone with a terminal illness might have a POST form on their refrigerator once they've had a conversation with their doctor and the doctor has determined it's an appropriate way to care for the patient, because it limits the amount of care. There's different things they can actually write on there. But if, let's just say that if you can't do, you can't really do a DNR at home. You do have that with hospice. You don't generally, if you have hospice care, if the person goes into cardiac arrest or respiratory arrest, you're not going to provide CPR and you're not going to call a paramedic. You understand that, right?
Yeah.
But some people have changed their minds in spite of the fact that the hospice company has spoken with them, and you certainly can change your mind, but you're not going to be on hospice service if you call an ambulance and go to the hospital, because that would be contrary to the type of care that they're providing.
Sure. Okay.
But does that make sense? Did I answer that?
Oh yeah. No.
Yeah.
You explained that very well.
Yeah.
So Lisa, if somebody wanted to work with you, tell us a little about the services you specifically provide and how do they get in contact with you?
Well, thanks. Yeah, what I do as a patient advocate is patients call me and they give me a rundown on their situation, and then we determine whether or not it's appropriate for me with my level of expertise, and I can help with a lot of different things. But, patient advocates, just like doctors, don't do everything. Like, they're specialists for doctors. They're specialists in the patient advocacy world as well. I mentioned, for instance, I know we've been talking down this road of end of life care. I don't do death doula work, but I know some patient advocates that do. I do. I can do some insurance follow-up work if someone has challenges following up with insurance bills or dealing with insurance companies. I'm willing to step in with some of that, but I would have to speak with someone directly to find out how deep that problem is. Some people are experts at that, meaning that these people have already been in the insurance business or have been a coder or a biller for a number of years. That is not me. So I would help them find another advocate. I typically deal with people with end of life choices, helping them with going through the process of advanced medical directives. I also have a Facebook group that I have for women. It's called Health and Wellness Solutions for Women. And for the last year, it's a growing group. For the last year, I've had many professionals on there talking about, second opinions and different kinds of doctors. I have had naturopaths on there. I've had psychiatrists on there, LCSWs and others who've come on and I've interviewed them. So all of those resources are available. So any number of things I can deal with. Also, I do have a real passion now, not just in advocacy, but as part of advocacy, because dealing with advocacy is dealing in that sort of safety and security domain, if you will. You remember Maslow's hierarchy of needs back in the day, that triangle. Yeah. So I'm kind of in the second one from the bottom, not your basic needs, but safety and security. And that includes things like health, and healthcare decisions, property and assets and finances, and also cybersecurity and security needs as far as and emotional wellness in your home and on the job. So
Okay.
I contract with people individually to do that, as well as establishing some programs.
Okay. Well, we're going to put all your links to your Facebook group and to your website in the program notes so that everybody can find them if they are interested in working with you. Lisa, this has been a very interesting and much needed, sometimes what you call a difficult conversations, but stuff that, you got to deal with this stuff, or else it's either going to be a huge problem for you, or it's going to be a huge problem for those that love you and take care of you. So you just need to get it done.
That's right. And also, taking care of all of this stuff as much as you can for yourself will also, your family will thank you, because your family won't be left worrying about what you would want or what you would need as you go along, and whether or not it's end of life, but just maybe even some cognitive loss might be your situation. But your family is going to be saved. Quite a bit of family fights, believe it or not, can be saved by your advanced planning. They will love you all the more for that.
I'm going to say sometimes. So, and on that note, Lisa, it was wonderful to have you on our program and to talk about this. And it's like I said, this is an important topic for people to know about and understand what their options are out there. This is Horace, the official old guy at oldguytalkstome.com. Remember, it's all about helping you create a kick-ass life for yourself and those that you love. And sometimes it's, talking about stuff that's not pleasant. So make sure you do. Until next time.
Thanks for joining me on this podcast. If you like what you heard and learned, then be sure to do 3 things. 1, subscribe so you don't miss the next episode. 2, share this with someone who may need to hear it also, and it may be your significant other. And 3, review it. Give me a good review. If you didn't like it, give me a bad review. I don't care. Just review me. And be sure to get my free video on 3 ways to get laid more frequently without begging. Opt in at oldguytalks.com. Don't be that guy that just takes in the information. Take action. Without action, you're not going to get the results you want.